Hi, welcome to our next presentation in our athletic training education series. This particular uh, presentation will talk about learning environments. I think some of this stuff is pretty common knowledge, but I just don't want to assume anything. So when we're talking about an athletic training professional education program, we were talking about three main learning environments where students will learn. The typical one is at a classroom, which I think all of us understand what we're talking about here. It's also known as didactic. You'll see that in some of the literature, and maybe when you're doing some research, you might need to use the term didactic. I don't know where our professional programs are going to go in the future. I don't know of too many of the professional programs or even the post-professional programs that are using the online environment all that much. I've had some discussions with some of my fellow athletic training educators about why can't we do a blended online type program. Have some of the coursework online, and then the practical or the laboratory and the clinical settings obviously would be in a campus setting. So we'll see where the future takes us with that. Obviously, I just said the laboratory. Laboratory is, most of you have probably done all these things, so I don't need to explain them all that much, but this will be a classroom time set apart just for clinical skills, can be for professional development type things. So it is a little bit different. It is still a classroom, but it is designed to help students work on some of their clinical skills and abilities. Then the last one is clinical setting, which we'll talk about in just a little bit. That's the clinical education, and I'm going to spend some time diving into the clinical education. I think it's important for us to remember the purpose of clinical education. Why do we do it? And remember that athletic training student is not a replacement for a certified athletic trainer. They are students. They're students number one, and they should be treated as students, should not be placed in positions where they are making decisions that they're not trained to do or are they legally allowed to do in most states except California. Okay, so as the CIE stands for Clinical Educators, Clinical Instructor Educators Workshop. It's a workshop designed to train the trainers, so the people who train preceptors on how to be excellent preceptors for students. So as they say in the workshop, students need to learn the psychomotor skills, which now in the new current competency, where those are the clinical integration proficiency, or CIPs, SIPs. Those are the psychomotor skills of their trade while encountering and assimilating the interpersonal skills, moral, reasoning, socialization, and attitudes distinguishing their profession's working environment. So that's a lot in there. So first talk about the skills. The skills would be taping, how do you do a Lockman's or anterior drawer test both at the knee and the ankle, and all those type of psychomotor skills that we need to know. But there's also a lot of other things that we need to know and that we need to teach our athletic training students, our future peers, the interpersonal skills. How do we deal with the patient who's injured? How do we deal with a coach when you tell them that their student athlete is injured and out for quite a long time? How do we deal with other staff members that you have some personality issues with? What about the moral reasoning? Should we allow this patient to play or practice or because you're getting a lot of pressure from the coaching staff to put that student athlete or that patient into a game when you believe that they shouldn't be, because they are it can be a detriment to their health. So those are moral reasoning. We have to teach our students about that. Socialization, I think I've talked about in one of my other presentations, that this was my area in my dissertation, was how do we socialize our peers, soon-to-be peers, into the profession of athletic training. There is a certain way to do things. There's attitudes and beliefs and all those type of things, which we're talking about, and these other things in our purpose of clinical education. what is the right way to do things. And sometimes those things are the right way, and some things we socialize people into the wrong things. And my opinion is one of the ways that we socialize ourselves and others, athletic training students and athletic staff, the coaches and all that, is that we think that we have to be at work all the time. We don't need to be at work all the time. It's not our job to live for our job. That model needs to be broken. We also need to socialize ourselves out of the attitude that we have to take these poorly paid jobs just because they have to have a job. Only way we're going to increase our salaries if we make some changes, and it has to start with us. Okay, I'm off of my soapbox now. I think I'm done with that. Some more purposes of the clinical education is that we're trying to take a student who's a novice, doesn't know really much of anything. We all been there. I remember what it was like to first start in an athletic training room, starting to learn how to tape. First start how to learn how to tape, cut tape, rip tape, then become competent in taping. And then all the other things that we do as athletic trainers. So it's the role of everybody in athletic training education, going back to that term again, the professional programs, to move them from being a novice all the way to a competent entry-level practitioner, because that's our goal by the time they finish their professional program. And in the clinical environment is the, quote, real-world laboratory. So we are exposing the student to controlled situations that they would encounter in the job that they will do in the future. Some of the disadvantages of some of the restrictions that we have now in the professional programs is how much autonomy do we actually give athletic training students. That is the challenge that we run into, whereas back when I was a student, I hate that term, but back when I was a student, I was still under the internship program where I was allowed to travel without any supervision, which was, I think about it now, is how stupid of that. What kind of risk was I putting myself in for liability issues, the school for negligence and liability issues, the patients, and all those type of things. It's just, I wasn't ready to be out on the road by myself. I barely had enough experience. So that's the purpose of the supervision, which our textbook talks about, and hopefully you've had some meaningful discussions with fellow athletic trainers, and even you may have these discussions if you go into the role of being like a program director or a clinical coordinator with your athletic training staff and the athletic department. So just some interesting things to ponder. Some more stuff about our clinical education design. We need to do teaching. We need to combine our get my brain working here again. The didactic and clinical experiences. They should be happening at the same time. We should, when we design our curriculum for a professional program, is what's happening in the classroom and in the laboratory should coincide with the clinical experiences. It's not always going to work out because more than likely the clinical things are going to happen a lot sometimes before students get to them in the classroom setting. That's why some programs in their like introduction to athletic training, whatever type class that is called, maybe a class that students take before they are even admitted into a program, will briefly go over, modalities. What is ice? What is heat? What's the indication, contraindication? Those type of things. So at least the athletic training student, when they are actually admitted into a program, have some background of ice, heat, ultrasound, and all those different things. So the question is, where do we do assessment? Where do we do the modalities course? Do we do that early in the program, they're teaching in the classes, or do we do it later? Those are the challenges. When do we do rehab? And so those are the challenges when you're designing a professional program, regardless of the level, if it's a master's or an undergrad program. And that goes with the second point. It's the how's theory and practical experience marry one another? When do they come together? Another thing is a student, it's common sense. You shouldn't ask a student to do a skill that they've not been taught, and they haven't demonstrated competency in at all. I don't know what your athletic training education was like. I was not allowed to tape an athlete until I had demonstrated that I can do that particular tape job correctly, and that's true of setting up ultrasound. That's true of setting up electrical stimulation, all the different types of it. That's true of pretty much everything. And it still needed to be supervised by my athletic training mentor, preceptor. And so the way we should progress knowledge skill is, first, it should be done in a formal instruction in a classroom. So we should teach them the theory. Laboratory setting, we should have them do practical evaluations, such as I was just describing. Okay, set up a scenario for them, for a student. You give them a scenario, have them do whatever you need them to do. It can be mock injury assessment, it can be mock treatments, and those type of things. So this can be done different ways. Then when they're out there being supervised by their preceptor, and an athlete or a patient comes in, it's not a emergency, and they've been working on lower extremity injury assessment, and a patient comes in with a lower extremity injury. You can have the athletic training student do the injury evaluation with your supervision. Just don't let them go. That's not what you should do. I mean, I've been guilty of that myself, so I'm not saying I'm perfect. That's the reality of it.